Inflammation is one of the major driving forces for chronic diseases that we see today. Whether it's heart disease, high blood pressure, diabetes, cancer, insomnia, depression, you can go on and on and on. For most chronic illnesses, there's an underlying chronic inflammation that's occurring. Chronic inflammation is quite different from acute inflammation. Acute inflammation is more like you fall down, you scratch your knee, and you need a body to heal at that time. We're not talking about that. We're talking about when inflammation is continuing on an ongoing basis, on a chronic basis. We've been able to devise here at my office a combination of various biomarkers, blood tests, for example, that are able to assess inflammation in the body. And I think that's so important because we can work with our patients to try to come up with a game plan that helps to reduce the inflammatory pathways. We're also looking at various other cardiovascular risk factors for inflammatory pathways, because cardiovascular disease, which is still the #1 cause of death in the United States, has also at its root core inflammation. And if we could reduce the inflammation in our blood vessel walls, we can greatly reduce coronary artery disease. Also, what are people eating? Specifically, dairy products, wheat products, sugar, ultra-processed foods, for example, high fructose corn syrup. All those are extremely pro-inflammatory to our body. And then we also have stressors that increase inflammation. We know that the 85,000 chemicals that are in the environment today play an important role in inflammation. So if we can reduce the chemical exposures that we come upon, whether drinking out of soft plastic bottles or putting different chemicals in our body every day as a deodorant or shampoos and things like that. So what we're doing is we're following our patients' chronic inflammatory biomarkers. All these things can help us address and put a patient on a better targeted plan and an individualized custom plan to reduce inflammation.